Autoimmune diseases are among the most challenging health conditions for doctors and their patients. Almost 2 million Americans suffer from Crohn's disease. With a cure elusive, the focus is on control. Here's the latest in this week's Positively Healthy. For the millions of Americans who suffer from Crohn's disease, life is a constant struggle from within. Symptoms range from abdominal pain to severe diarrhea, bloody stool, weight loss, and fatigue.
Crohn's disease is an inflammatory illness of the intestinal tract, and it can really affect anywhere from the mouth all the way down to the anus.
Dr. Michael Cohen is a board-certified gastroenterologist. At this point, doctors recognize the chronic condition is caused by the body turning on itself, but there are still many questions.
It could be considered an autoimmune disease because it seems like a part of the underlying genesis of the illness, which we're still sort of elucidating right now, is a perhaps dysfunctional immune system.
Newest research is looking at the role heredity plays and potentially targeting a gene that may be causing the exaggerated response.
This immune response triggers a whole inflammatory sequence. It's a big cascade of various chemicals that are involved in the immune response and lead to inflammation. And this inflammation manifests itself oftentimes as what we would almost consider like canker sores of the bowel.
With the exact cause uncertain, doctors are instead concentrating on managing the condition.
There are drugs that we call biologics, and at the moment, biologics are only administered either through infusions through an intravenous line or self-injections like a diabetic would give themselves insulin. There are other drugs called immunomodulators which are available in pill form. And these drugs have really revolutionized the treatment, and we often, as I mentioned, use the injectables as well as the orals, the biologics in combination with the immunomodulators. And our goal really is to try to prevent end organ damage.
In the absence of a cure, remission is more easily achieved, making the disease and its symptoms almost undetectable.
Where they have no symptoms, where their endoscopy reverts back to normal, and their blood markers and stool tests may revert back to normal. And that's really, at the moment, the holy grail.